So based on my experience in head and neck cancer, what I have seen in the patient, right now we need to go for the personalized therapy. And to achieve those kind of therapy in realistic setup, we need to focus on the clinical biomarkers. So basically, those who are suffering from locally advanced, recurrent, and metastatic cancer state, right now, what we are doing and what I have seen in the clinics, that they are performing the biomarker test and they are checking for PDL1, CLT4 mutation, and the newly found mutations is HRAS mutation, which is one of the proto-oncogens. If it is targeted, then the drugs which is inhibiting this HRAS gene is right now under clinical trial. So we need to focus more on those biomarkers, identification of those biomarkers, and specifically drugs which is targeting those biomarkers need to be prescribed to those patients so that the survival can be improved as well as quality of life also can be improved, because immunotherapy is much less toxic compared to the chemotherapy. But when we combine chemo and immunotherapy with the concept of metronomic chemotherapy, which is low dose, sustainable, chronic therapy, just to overcome the toxicity issue, which is again new concept, which is also can be implemented to the individualized therapy. And we need to expand this PDL1 inhibitors, pembrolizumab, nivolumab, which is widely prescribed nowadays in the setup of head and neck cancer. So I believe that the clinical trials conducted on immunotherapy need to be strengthened. It should be enrolled more cohorts of patients suffering from head and neck cancer. Real life studies on those immunomodulatory therapy should be conducted. Moreover, I believe that rather than treating the patient in the recurrent stage as well as metastatic stage, we need to strengthen the initial therapy, which is induction therapy, neoadjuvant therapy, and adjuvant therapy, where we can introduce the immunotherapy, which is not much studied nowadays. So if we can study at that level, we can obviously prevent the recurrence of head and neck cancer, and we don't have to treat at the later stage where we are finding very difficulty to treat the patients. I think I have focused on the major key points for the patients suffering from head and neck cancer and how the treatment should be comprised of and what futuristic goals we should have as a researcher to conduct more research in the area where we can find some kind of strategies where we prevent rather than cure the conditions arising nowadays in head and neck.